So the objective of today's presentation is to provide an overview of our organization and, most importantly, to introduce you to our website and to teach you how to navigate it efficiently so that you can help yourself or you can help your patients or clients. Who is NeedyMeds? We're a national nonprofit organization. We are an informational resource. We have a website that helps about 1.3 million people each year, and that includes patients, family members, healthcare professionals, social workers, and patient advocates. All the information on the website is free. You don't have to register for it. You don't have to give us your email address or your name. You can remain completely anonymous. And we also have a toll-free helpline, which provides all the same information to people who do not have internet access or would prefer to have someone assist them in that search process. So how did NeedyMeds come about? Well, in 1996-1997, our current president, Dr. Richard Sagel, was a practicing physician, and he and his co-worker, who happened to be a social worker, discovered that some pharmaceutical companies offer prescription assistance programs to people who qualify. And they thought, that's interesting. Most people don't know about these programs. We want to do something about that. So because this was in the late 90s and the internet was becoming an important source of information, they decided to make a website. And when they made the website, they decided that they wanted to stick to 3 guiding principles. They wanted the information to be free and anonymous. They wanted the information to be quick and easy to find, and they also wanted all of the information to be accurate and up to date because these programs change frequently. So they started compiling this information on the website, and what started as just a handful of programs has now grown, and today we have over 5,000 programs on our website that will help patients with their healthcare costs. You'll find financial assistance programs under the Patient Savings tab on our website, which I'll show you in just a minute. There are several ways in which patients may save money on their prescription drugs and even other sorts of healthcare costs. Mainly, that is patient assistance programs, or what we call PAPs. There are diagnosis-based assistance programs. There's a section on our website that will have coupons, rebates, and more. I'll talk to you a little bit about our drug discount card. And we have other resources on our website as well, including government programs, imaging discounts, Heal Funder, a medical bill mediation service, and programs related to camps, scholarships, retreats. We try to be as comprehensive as possible. So the first area I want to teach you about, and some of you are already familiar with this section of the website, patient assistance programs. These are programs that are sponsored by the pharmaceutical companies, and they will provide free or discounted medicines to people that are eligible. There's no law requiring a pharmaceutical company to offer a program like this. They do this to be good corporate citizens, and so because there's no law mandating this program, there are no rules for PAPs. So each program will have its own unique eligibility requirements, its own application process, its own deadlines, and so on. One requirement, however, is that healthcare providers need to be involved. They need to provide a valid prescription for the patient, and they typically need to sign the application. So where can you find more information about PAPs? Well, that's where NeedyMeds comes in. And with that, I would like to take you on a tour of our website. So I'm going to open our homepage, which is www.needymeds.org. There we go. Now to continue our search for PAPs, you can simply type the name here in the drug search box, and it will pull up PAPs for that medication. Or you can go to our Patient Savings tab, and this is where you'll find all of the patient assistance programs. So let's say I'm looking for a particular medicine. I can search by brand name or generic name, by the name of the program, by the name of the pharmaceutical company that sponsors it, or by the name of the particular application if you know it. I'll start by demonstrating a brand name drug. Scroll down and you'll see we have a handy alphabet bar. Let's say I want to look for the drug Abilify, which is right here. This little scissors icon tells you that we have a coupon available for it as well, which Deb will explain in just a moment. And here where it says View CR article, CR is for Consumer Reports. We're very proud to have a partnership with Consumer Reports. They've put together articles talking about different classes of drugs. And if you click on this link, it will pull up an article related to antipsychotic drugs in which Abilify is mentioned. So it's more information for you so you can be an educated, empowered consumer. So here's Abilify, and I want a PAP for Abilify. So you can see here that Abilify has one program right at this time. Some drugs will have more than one prescription assistance program available, and if that's the case, we always organize them so that programs that provide the most assistance are at the top, and programs that provide lesser assistance are listed toward the bottom. So here's the name of the program. It's called Bristol-Myers Squibb Patient Assistance Foundation. Here's the contact information for Bristol-Myers Squibb. That's the pharmaceutical company who's offering this program. Should you have any questions specifically pertaining to the PAP application, please contact Bristol-Myers Squibb as opposed to NeedyMeds. We are the informational resource that will connect you to the programs, but specific questions about the program should be directed to the pharmaceutical company. You can call their 800 number or you can go to the program website. Scrolling down, you'll see that we have an application that's an active PDF link, which means you can click on the link, fill out the application online, and then print it. Whenever a pharmaceutical prescription assistance program has that available, we do put it on our website. Some of them, however, will still require that you contact them and then they'll mail you out a paper application. So it varies. This section will tell you which medications are offered in this program. Here we have Abilify in an oral solution as well as a tablet. I mentioned earlier that these programs are available to people that qualify. And usually that qualification is based on income, insurance, the type of insurance you have, the type of coverage you have. And sometimes it's even based on a multiple of the federal poverty level. What does that mean? Well, here you'll see what the eligibility requirements are, and for this particular medication, they're looking for people who are at or below 250% of the federal poverty level. You probably don't know what that is off the top of your head, so we've provided this handy calculator right here where you can type in your information. Let's say there's an annual total household income of $50,000. You'll notice I did not use commas. Let's say there are 3 people in my family, and that puts me at 252% of the federal poverty level. Going back, we see that this company is looking for people at or below 250%, and we're just over that by 2%. One thing we would recommend is that instead of giving up, simply call the program and explain your situation to them, and they have the authority to sometimes make economic hardship exceptions. So if you catch the person and perhaps they're not willing to help you, I would even recommend going so far as to call back at a different time or a different day and speaking with a different person who may feel more lenient toward your situation. And this happens every day. There is some room for subjectivity in this application process, and we encourage you to take advantage of that if necessary. So don't be shy about asserting what you need and being persistent if you're just over their eligibility requirements. In this next section where it says application, it will give you information about how to return the application, and how long it takes to turn around the application. You'll see here the decision time frame is something you want to pay attention to. Usually it takes between 2 and 4 weeks for a program to accept your application, review it, and give you a reply. It'll tell you specifically here. This program, as I said, is within a week. And then the last section where it says medication will tell you where they'll ship the medicine. It's usually to either the patient's home or the doctor's office. And here, in this case, it's the doctor's office. So those are the sections you want to pay attention to. Okay, so that's how we would search for a brand name drug. You could do the same type of a search for a generic name drug. You could look for the name of the pharmaceutical company, or you can go directly to the application if you've used it before and you already know what it's called. One thing we would recommend against, however, is the temptation to print out a stack of applications and use them over a period of time. These programs change quite frequently. They change eligibility requirements. Sometimes they close altogether. You really want to make sure that each time you're applying for a patient assistance program, you need to get the application off the website within a reasonable time period when you're applying. Please don't get stuck because you're using an old application and they won't process it for you, and it's just going to add time and delay the receipt of your medications. So again, please make sure you're always using a current application. These applications can be complicated, especially if the person is not comfortable using the internet. And so in order to help you with that, we've put together a section here called Help with Prescription Assistance Applications. Clicking on this link and you'll see that it provides a national directory of nonprofit organizations across the country willing to help people fill out these applications. You can search by zip code or you can search by state. Searching through Arkansas, you'll see that you have 24 organizations in the state of Arkansas that will help you. Some of them will do it for free and some of them will do it for a small fee. It varies. If you know of any programs in your state or community that are not listed, please let us know. We'd be happy to add them to the list. And now my colleague Deb will demonstrate some other resources on the website for you. And I'll be back in just a moment.
Thank you, Lori. This is Deb Lindahl. I'm here to talk to you about some patient savings areas of our website. So let's see. First, I'm going to talk to you a little bit about free and low-cost sliding scale clinics that we have listed. Currently, we have over 13,000 free and low-cost clinics in our database and other facilities that will discount their prices based on somebody's income. For your convenience, that we have separated the medical and the dental clinics, and you can search for each in the following manner. You can either look it up by state or in the drop-down. Hold on. You can enter your zip code to see what clinics are near you. Let's go ahead and enter the zip code where we are here in Gloucester, Mass. And I'll go out 15 miles. And as you can see, we know of 14 clinics around our office. Scrolling through each, you'll see the name, the eligibility requirements, and the details of each of the clinics. These won't necessarily be just medical, but they may be a women's health clinic or even provide STD testing. Some of these clinics may also offer dental services, and should you just want dental services, you go back to the main clinics page and click on dental clinics. Also, if you're working with a client and you want to provide a list of the clinics, click the ones that your client can go to by simply clicking on those individual ones, or click print all, and the entire list will be printed. Next, we're going to go back up to patient savings, coupons, rebates, and more, which I think Lori had sort of touched upon right here. Also, I would like to remind you that Lori and I will be including our contact information at the very end. So you're able to email or call us with any additional questions that may derive from this webinar. Back to coupons, rebates, and more. This section of our website is where we list coupons for prescription medications, as well as over-the-counter medications and medical supplies. In addition, we have helped with the cost of a copay, as we listed the copay cards in this section. We provided several ways to find coupons. Each way will display the offer, an explanation of what that offer is, and when it expires, and the manufacturer's link, which will bring you the closest we can get you to either signing up for that offer or printing it out. First, we'll click on brand name drugs, and you'll see a coupon icon next to certain drug names right over here. Clicking on the icon next to the drug name will take you to the page with a listing of any coupons offered for that particular drug. We'd still encourage you to click on the name of the medication to see if there is a patient assistance program available. And as we would all agree, to get a medication for free or significantly reduced in price would be the best option. However, if you do not qualify for the program, you can use an available coupon. Going back up to the main coupons, rebates, and more page, you'll see a second way to look up offers is to search by product name, by product name. There we go. Clicking on this link, again, you'll see this A through Z bar, which is throughout our website, where you can look up the medications alphabetically. I'll click back to get us back to the coupons, rebates, and more page. There. And I'll show you the final way to look for coupons is to do a search by category, meaning by diagnosis or by symptom. So if you want to look up any offers available for, say, the diagnosis of asthma, for instance, you click on the asthma link and you'll get a listing of all of the offers for drugs or medical supplies for the diagnosis of asthma. Going back up to the Patient Savings tab, I'm going to click on a new program that we have offered, which is called GAP. And it's actually currently being offered by NeedyMeds. And it's the Generic Assistance Program, which NeedyMeds has been a leading resource for information on patient assistance programs to help cover the costs of brand name drugs. But there are hundreds of programs providing free or low-cost brand name drug medications, but there's yet to be an assistance program that helps with the cost of expensive generic drugs. It's a common misconception that the generic medications are all inexpensive. The truth is that there are many that cost hundreds of dollars per year and are essential to the health of many people. With the help of ARC's Outreach, the largest nonprofit pharmacy in the country, NeedyMeds has launched a first-of-its-kind generic medication assistance program. The program uses a voucher system, and it supplies medication for up to 1 year. Applicants must apply to us to enroll in the program and reapply annually. Once accepted, coverage is guaranteed for the acceptance of the prescription for 1 year. So we're very excited about that program, and we've received a tremendous response. Next, I'm going to talk about our diagnosis-specific area. Resources, they've been placed in this one spot. We're going to look up DBAs, or diagnosis-based assistance, first. These are the programs that help people with their various costs of medical care associated with a particular disease or group of diseases, such as cancer. They can offer assistance with medical supplies, travel, equipment, testing, and more. And as many of you know, there's lots of costs that people need assistance with. So this is a section that you would look to for diagnosis-specific assistance. I'm going to go ahead and click on diagnosis. And one that we get too many calls for, D for diabetes. Scrolling down, you'll see the various programs that we've listed. You'll see all the national programs listed first, and then we have all the state programs listed alphabetically as you scroll down. There we go. To review what each offers, look under services, as they often vary from program to program. So it's program name, summary of what they provide, and the services they provide. Some provide much needed medical equipment. and testing. They can even cover travel expenses and so on. And there's a great deal of help out there. It's really just a matter of knowing where to look. Just like many programs on our website, clicking on that program will bring you more information. If you're unable to find any programs, this is also very important. Looking at this area, directly above the table, you can see that there are some other suggestions of categories of information to look under if you can't find the help that you're looking for. As mentioned earlier, this is just one way to look up these programs. I'll go back up to our top navigation bar where you can look them up by area of service, as well as alphabetically by the name of the program. Next, we're going to go to our disease information pages. But before I do, I would like to remind you all, should you have any questions, please type them in the questions bar in your control panel, and we'll answer them at the end. Let's go ahead and click on liver disease. On some of these pages, we've worked with disease-based groups, and some we put together ourselves. Either way, they're going to have information on a particular disease. On the right-hand side are additional links to information and resources. Scrolling down, you'll see a list of medications that someone may be taking who has a specific diagnosis. Also at the bottom of the page, you'll see which links can connect you to the diagnosis assistance program associated with that particular disease. What's really helpful with these pages is that if you're working to help an individual with a specific diagnosis, here's a way to quickly find all kinds of help. Going back up to the Patient Assistance Savings tab, under disease-specific area, you'll see camps and retreats. Scrolling down, you may notice, let me just click on, let me go back. There it is. So this is the area where we have our camps and retreats. Scrolling down, you may notice that we've add a program information page. These are throughout our website. They're designed for organizations that may offer programs or resources that currently are not listed but are applicable to the same disease. If any of you are aware of them, please, programs that aren't included, please complete this and send it back, and we'll see that they're included on our website. Back to camps, there are 4 different ways to sort for camps. One is by diagnosis, by camp name, by sponsor name, or by location. I'm going to go ahead and click on by diagnosis, and we'll do a search by ADHD. Currently, we know of 77 programs for ADHD. We also list camps and retreats for family members who may have a parent or a family member suffering from a particular disease. Also, you can see here a summary of camps, where they accept campers from, over here, and the location of the camp, of course. Next, we'll go back up and look at diagnosis-based scholarships. They're based on diagnosis, by residency of where the applicant lives, or search by scholarship name. And lastly, I'll touch upon government programs that we provide for you. Clicking on them, you'll see a number of state-sponsored programs, as well as Medicare information and Medicaid sites. Our website also provides a list of SHIP sites, which are federally funded health advisory programs that provide health insurance counseling to Medicare recipients. And finally, Lori had touched upon the Federal Poverty Line Guidelines. Here's where you find that information, along with your tax return request forms. That information is all included in this area. Thanks again for listening, and I'm going to pass you back to Lori.
Thank you so much, Debbie. Okay, so continuing with our tour of the website, we're just finishing up here. I just briefly wanted to mention to you that you'll find some additional resources over here in the right-hand corner. For example, we've partnered with an organization to offer discounted MRI and CAT scan services. You would simply plug in your you would apply here by clicking on this link, or if you don't want to apply online, you can call the 888 number that you see here, and you'll speak with someone. She'll take down your information, and they'll refer you to a clinic or a facility that would offer this particular discounted program. Currently, there are about 2,500 across the country, and I think the average savings at this point is between 50 and 75%. We've also partnered with a company that will offer medical bill mediation services. If you or your patients have $1,000 or more in unpaid medical expenses, this might be an option for you. They would negotiate on your behalf to bring down the total price of the bill, and they say that the overall savings is usually more than 50% of the total bill, maybe averaging about 30% off your bill, which is better than nothing, especially if you have a huge bill from perhaps an uninsured stay in the hospital or something like that. If you're interested in applying to this medical bill mediation program, simply call the 800 number here, and one of our helpline operators will direct you through that application process. Going back to the Patient Savings tab, we've also started a medical bill crowdfunding platform. We've all heard of Kickstarter, FundMe, Indiegogo, and we've all heard of people who fundraise on those websites to pay for their medical expenses. What's unique about our platform is that it's the only crowdfunding platform that is specifically for medical expenses, and this can include medically necessary procedures. It can include cosmetic procedures. It can also include things like orthodontia, as long as it's a legitimate medical expense. What's unique, as I was saying, is that we verify the condition, and we verify that the funds raised are actually going to pay those medical expenses, whatever they might be. And so in this vein, we hope to eliminate the possibility of fraud, because we've all heard of those stories where people fundraise and they say it's for one thing, but perhaps it's not. If you want more information on this, my wonderful colleague Evan would be happy to provide that to you. Feel free to email him at this email address here, info@healfunder.org, and he'll give you more information. And lastly, I wanted to touch on our drug discount card, which is something that NeedyMeds is famous for. So let me just go back to the PowerPoint. Here we go. And tell you about the NeedyMeds drug discount card. There are a lot of drug discount cards out there. Ours is unique in a number of ways. First of all, our card can save users from 0 to 80% off the cash price of a prescription medication, an over-the-counter medicine or supply if it's written as a prescription, like aspirin or glucose testing strips, and even pet prescriptions if you purchase them at the pharmacy. And how does the card work? Well, some cards will ask you to sign up for it, which means you're giving them your name and your contact information, and they can track what you buy with the card. We don't want to do that. We want our card to be completely anonymous to use. So there's no activation, no registration. You don't have to give us your name. As soon as you get your card in the mail, or if you print one off our website, you can use it immediately. You don't have to do anything special. The card never expires. It can be used by more than one person. There's no eligibility requirements. It doesn't matter what your citizenship status is. It doesn't matter what your income is. It doesn't matter if you have insurance or not. It's accepted at over 63,000 pharmacies across the country, including all the major chains and even some of the smaller chains as well. And all you have to do is bring the drug discount card with you to the pharmacy with your valid prescription, and the pharmacist will tell you what the discount is. Who can use this card? Anyone can use the card. The only rule, however, is that it cannot be combined with your health insurance. If you're uninsured, go ahead and use the card at any time. If you do have insurance, whether it's public insurance like Medicare, Medicaid, or even if it's a private insurance plan, you can use the card instead of your insurance. So if you find yourself in a coverage gap like the donut hole, if your copay is too high, if your deductible is too high, or if your medication is not covered with your insurance, please, we encourage you to try the discount card. You may be able to save, and something is better than nothing. How do you get your free drug discount card? If you are an individual, you can print one off our website. It's on our home page on the left-hand side. Or you can send us a self-addressed stamped envelope and we'll mail you out a plastic card if you prefer. If you work for an organization or a healthcare facility, a company, a city or a town or a state, and you'd like to request a supply of cards and brochures, we'd be happy to send them to you at no charge. And we'd even be happy to customize those cards for you, and I'll tell you about that in a moment. Anyone can use these cards, and we encourage you to try them. The discounts are negotiated between pharmaceutical companies and pharmacies, and they renegotiate these discounts all the time. So discounts will vary from month to month and even from pharmacy to pharmacy. So if you're not getting the savings that you want one time, try it again the next time you fill that prescription because the discount may have changed. And as I said, not everything is discounted, but that does change frequently as well. And so on our website, we have some tools for patient advocates, healthcare professionals, people who work in the field helping patients apply to these programs. And I just briefly wanted to show them to you. Not really going to spend that much time on them. But if you go to the Advocates tab at the top in the blue banner, you'll see that we have a few resources for you. First of all, we have a new program called Patient Assistance Resource Education, or PAIR as we call it. And this is a self-paced online tutorial, which means it's on the web. This is for organizations or healthcare facilities that want to offer some professional development to their employees. It's very similar to the webinar that we're doing right now, but it targets the needs that a healthcare professional or a patient advocate would use. And at the end of the course, which probably takes about an hour if you were to do it all in one sitting, at the end of the course, the student who passes the exam will receive a certificate of completion for their portfolio. We also have a patient advocate newsletter that comes out about every month or so, where we offer tips on helping you help your patients or clients. That's free to sign up if you like. We also have what we call the Patient Assistance Program Update Service, or PAPIS, over here. And this is a weekly or daily email alert that will tell you every time NeedyMeds has updated a record pertaining to a patient assistance program. And so if a program has opened or closed, or if the eligibility requirements have changed, you can sign up for this service and you can opt for either daily or weekly alerts, and we'll let you know what those changes are. And also, I wanted to mention that we offer software for organizations that do a lot of patient assistance applications on behalf of their patients or clients. We call it PAP Tracker. If you're a nonprofit, you may qualify for a grant that we're offering right now, which would provide it for free for a certain period of time. PAP Tracker is really handy if you do help your patients or clients apply to these programs, because most of these applications, if you're doing them one by one, they take a lot of time. And if you have a patient or a client who has more than one medication, you can see how involved that process might become. So with the PAP Tracker software, you simply input the patient's information once into the database, and then you can generate applications for all the different medicines that they need. It makes the application process very easy to do, and so the same number of staff can generate more applications on behalf of their patients. It also helps you with collecting information for reports, particularly if you have funders that need reports. It helps you manage the refills. It helps you manage the renewal process, and it lets you track where the medication is in the process. We love to partner with like-minded organizations. If you are an organization, a nonprofit, a city or town or state, a healthcare facility, a hospital, we want to work with you. And there are a number of ways in which we can work with you. I mentioned briefly that we can customize drug discount cards for you. We can put your name and logo on our drug discount cards, and you can distribute them to your patients or clients. We can do webinar trainings for your staff to teach them how to use the NeedyMeds website, and there's never a charge for that. We can partner with you if you have expertise in a particular condition, diagnosis, or disease, because you can help us maintain our disease information pages, and we can promote your website on those pages. We can help you establish or manage a patient assistance program or a copay card program, and we do this all the time, and it's very rewarding for us. So if you are a foundation out there, or if you are with a pharmaceutical company and you're interested in setting up a patient assistance program to help people, we will help you do that, and we will make it very easy and rewarding for you to do so. We also love to be posted as a resource on your website so more people can find us. And we also would love if we could work with you to share opportunities on social media and post information that your clients or patients or members might be interested in learning about. We have a volunteer project that we offer organizations. We can help you train volunteers to start a program to help people use the NeedyMeds website to find these resources for patients or clients. If you are a clinic out there and you don't have the time, the staffing or the time to help people apply to these programs, I can help you start a volunteer project so that volunteers can do that for you. And lastly, as I mentioned, we do offer software to organizations. If you're an individual and you'd like to get more involved with NeedyMeds and you'd like to help spread the word about us, you might be interested in learning more about our ambassador program. This is a program where volunteers will promote or represent NeedyMeds in their own community. And this might mean attending a conference on our behalf and exhibiting there, or perhaps tabling at a health fair, or maybe it means giving a talk at a civics group meeting, or maybe at your church or synagogue or a mosque. Whatever you would like to do to help spread the word about NeedyMeds so that more people can find this information, we'd be happy to work with you. We welcome creative, energetic, passionate people to this program. If you're interested, you can email me, Lori, or you can use this NeedyMeds address here, outreach@needymeds.org. And so as promised, Deb and I wanted to give you our contact information. If you have any questions, feel free to email us if we don't get to your question today. But in the meantime, we would like to take some questions while we're live, and we have a few minutes. So let me just see. So one question is, when you're applying to these programs, will the applicant need to provide documentation of annual income? And yes, most often they will. Each program varies in eligibility requirements, but usually they do want you to verify your income. And we do have a tax return form on our website under the government-assisted programs, I believe. And that's also where you can find the calculator, again, for the federal poverty lines if you need that. Will a copy of this presentation be made available? Sure, if you'd like a copy of the slides, feel free to email Lori@needymeds.org. If you would like to see this webinar again in its entirety, we will put it on the NeedyMeds library page in a week or so. And it will also be on our YouTube page if you want to see this whole thing again. Okay, I'm just reading through a question. Bear with me for one moment, please. So a question is asking, if you're looking at a PAP program and the eligibility requirements say that the person cannot have any medical insurance, does that automatically disqualify a senior citizen with Part D insurance, but who is otherwise in the donut hole? Yes, people run into this quite frequently, unfortunately. It often does mean that literally you must not have any medical insurance. If you want to pick up the phone and you've got the time, you can certainly call the program and plead your case. They may be willing to make a hardship exception, but often if it says no medical insurance, they typically do mean literally no medical insurance. But again, it's always worth a shot to plead your case. Nothing wrong with that. The other option is to also see on our website the other sources that Deb and I mentioned. You can look at the particular diagnosis or condition that you're seeking help with to see what other sorts of resources we have for you. You can try using the drug discount card if you find yourself in the donut hole. And also we have coupons and rebates listed on our website, and that might be another avenue to try as well. So, you know, the PAPs offer the most assistance, of course, but if that's not working out for you for whatever reason, then we encourage you to try these other resources on the website as well. That's what we hope we teach you during these webinars, so that you feel comfortable and you know what resources are out there, and you know that if the PAPs don't work out, that you might have other options, and we hope you take advantage of them. And so a question here is, can you use the NeedyMeds drug discount card if you have Medicare prescription coverage? The answer is yes. You can use the drug discount card regardless of your insurance, but the only rule is that you don't combine it with insurance. In other words, you would use it instead of your insurance. You can ask the pharmacist to try both the drug discount card and your insurance to see which one is cheapest. They do that all the time, and they should have no problem doing that. And by the way, if you ever do run into a difficulty using the drug discount card, there's an 800 number on the back of the card. Simply call that number, and our helpline operators will make sure that the pharmacist is giving you the correct information and that they're helping you in the way that they are contracted to help you. I'm just reading through questions. Oh, greetings to my fellow Floridians. I'm from Florida. Can you get a stack of cards for your patients? Yes, absolutely. We would be delighted to send you out a stack of cards and brochures as well. If you want a drug discount card for yourself or for your patients or clients, please email Deb with her email address right here, deb@needymeds.org, and provide your name, contact information, how many cards you want, and how many brochures you want. And our brochures come in English, Spanish, Portuguese, Russian, and Cambodian. The Cambodian one they can all be printed off the website. We don't have any printed Cambodian ones at this time. Yes, so if you want brochures, please feel free to email Deb, and she will make sure that you receive them. Yes, the question is, are there any resources for assistive technology assistance programs on our website? There certainly are, and you will find them under the Patient Savings tab. If you look at the right-hand corner, you'll see the section for government programs. They're in there listed by state. So you want to pull up your state and then read the description and look for words like assistive technology in the description, and that will tell you where those programs are. And that's something that we've recently added to our website. Thank you for asking. I'm just reading a question here. Please give me one moment. You're welcome, and thank you very much for letting us know that the website has helped you help your patients. We're very happy about that, and we love the positive feedback. So I think that's all the questions we have today. If we didn't get to your question, feel free to email Deb or me, and one of us will get back to you. Again, if you want a copy of the slides, feel free to email Lori. If you want drug discount cards or you have any questions about them, feel free to email Deb. If you have any questions about looking for financial assistance programs, the best place to go is either the website, or if you need a little help with the website, call our 800 number at the bottom of the screen. This is our helpline number, and our helpline operators are trained to help you find financial assistance for your healthcare costs. They're open Monday through Friday, 9 to 5 Eastern Time, and those are the people you want to direct questions to pertaining to prescription assistance programs and other sorts of patient assistance programs. So with that, we thank you for giving us your time today. We hope that this has been helpful. We look forward to seeing you again in a month. And when we close, a brief survey is going to pop up, and we would appreciate your giving us your feedback about this webinar. And once again, if you have any suggestions as to how we can improve the website, or if you know of any programs that should be on our website but are not, please let us know. We want to add them. So thank you for your time and have a wonderful day. We'll see you in a month. Bye-bye.